What happens when traditional dentures are more harmful than helpful? This is a story of how digital dentistry gave one patient their smile back using shiny 3D full digital solution from facial scanning and their newest intraoral scanner Elite. Years of denture use led to bone resorption, discomfort, and lost confidence. But with digital dentistry, we gave this patient a new future, fast, guided, and personalized smile. Hi there, I'm Dr. Amirinasab, periodontist and implantologist, and today I want to review this case. We used a fully digital approach to solve the patient's problem. Our patient arrived with a common but complex issue: severe bone resorption from prolonged use of the full denture, functional limit, aesthetic concern. The solution: a digitally guided Aoralscan protocol. We begin with diagnostic imaging and digital facial scanning to plan everything before scanning the procedure. The shiny 3D face scanner captures the patient's unique smile line, facial symmetry, and jaw posture. The ability to evaluate the smile design parameters at this early stage, including lid support, and size of the display, and midline orientation, helps achieve a predictable aesthetic outcome. Using the facial data as a reference, we design our digital plan to harmonize intraoral restoration with patient overall appearance. Next, it was time for shining. The star for denture cases, Aoralscan Elite. This magical scanner offers an iOS and IPG in one device. Fast, smooth, and precise, especially since it's designed for edentulous arcs. The real power of this scanner is when we place the scan bodies over the implant, the system automatically recognizes their shape and orientation. Makes your process joyful for your patient and yourself as well. Here's how it works. Each scan body has a unique top surface geometry. The Aoralscan Elite detects this and matches it to a preloaded implant library, instantly placing a virtual abutment in perfect 3D alignment. No manual step, no room for error, just sending data from a scanner CAD/CAM software. With planning complete, we printed the surgical guide to ensure safe, accurate implant placement. Implants were placed with full control based on digital plan derived from facial and intraoral scan. This level of precision minimizes surgical time and speed of recovery. After healing, we scan again using the Elite for final prosthesis because the digital model included both bone and facial data. The final design honored function and aesthetics. The moment that the treatment was complete, the patient couldn't stop smiling. It wasn't just about the new smile, it was the comfort of knowing that every step from initial scan onward was powered by Elite technology built for accuracy and reliability. This is why when we speak about shining 3D company, we speak about full digital solution.